So today's patient is a 75-year-old lady. She came with a fracture in her lower spine, and because this fracture did not heal, she was continuously getting pain in her back and then some pain also radiating into the lower limbs. So we have taken her up for a minimally invasive procedure of vertebroplasty along with percutaneous stabilization. So I'll just go through the steps a little bit. So this is how we have gone in. A little bit of a stab incision is made. We put the needle inside, and this needle is going in through the pedicles, and now we are seeing on the lateral view that it is going into the pedicle. We just confirm whether it is in right position, and once we have confirmed the position is correct, we have aspirated. This is the fluid which has been aspirated from the vertebral body, which was the fluid of the non-union because the fracture is not united there. This is the cement which is injected into the vertebral body. This is how it is filling up slowly. We are seeing that it is filling up. This is the fill up of the cement all the way across on both the sides. Once the cement is adequately filled, then we check on the AP view as well that it is filled up properly. Then the next step is that we start putting in pedicle screws into the bodies above and below. So this is the needle which is going inside. So we are putting the hook needle into the vertebral body above, and once it is in, we leave the guide wire inside. The same thing is then done on the next on the level below. So this is how the needle is going into the level below. We have to make sure that it is proper on both the views so that it is perfectly in the body. So this was seen that it was not proper, so we have put it again, putting in the needle again, making sure that it is in the right position. So once we are sure that it is in the right position, then we leave the guide wire inside and we take it out. The same thing is then done on the opposite side as well. Guide wire into the opposite side, and then at the level above and at the fracture level as well, we will be putting in the guide wire. So we are putting in the guide wire on the level above. Once that is done, then we are going to do it at the level of the fracture on the opposite side. So we put in a guide wire at that level. The next is that we are going to tap that, and now we'll start putting the screw into that level. After that, we are putting the screw at the lower level, and we take the guide wire out. Then we put in the screw at the level of the fracture. This is then repeated on the opposite side as well, putting in the screws. When after that, we put the rod in, and then we make sure that it is in the right position on AP view and on the lateral view. So this is done minimally invasively, so there is no major cutting. It's just 1 stitches at each level, and the patient will get much lesser pain and no blood loss during the surgery, and she can then get up and start walking today itself. So if you have a spine fracture, do ask your spine surgeon about something like this.